found out, I found a lump in my right breast when I was taking a shower. The next day I called my gynecologist. I said I have a lump in my right breast and it's pretty big. So he said come in right away.
Patients that are having problems, either lumps, pain, nipple problems, nipple discharge, things that their doctor may feel, even if they don't feel it, they would be referred for a diagnostic study. And typically, we would begin, if a patient is over 30, we would begin with a mammogram and then an ultrasound, usually targeted to the areas of clinical concern. At our center, we are able to offer same-day services to include mammography, ultrasound, and even biopsy if it's needed. So if we find something on ultrasound that warrants a biopsy, we can do ultrasound-guided procedures the same day. So before the patient leaves, they will have had a chance to have all of their imaging and their biopsy, and the results are usually available to the patients in a couple of days, always within a week.
And the biopsy came back positive for cancer. And they did more testing, and it turned out that I had a triple negative breast cancer, which is an aggressive type of breast cancer not associated with the hormone.
After a diagnosis is made, the patients have a tremendous number of resources here, and they can be connected with our breast specialists, who are dedicated surgeons, breast surgeons, and they would also have an opportunity to visit with the oncologists and radiation oncologists if they needed it, in addition to multiple other support services that we have available.
The first one I found out, believe it or not, was one of the partners here, Gary. I came back from the doctor's office, which is right across the parking lot, and of course I was hysterical crying.
I remember it very clearly. She was walking down the hall, and I was walking down the hall. It was after hours. I think she came back to the office to collect some of her belongings, and we ran into each other, and I said, "What's the matter?" And she looked at me, and I could tell there was something wrong in her eyes, and she said, "I have breast cancer." And I felt horrible for her, and I kind of understood what that means to somebody, to a woman, to a family, co-workers, and I tried to comfort her as best as I could. And I just told her that, don't worry about us here, don't worry about your job. You can have as much time and as much support as possible from us. We're all one big family.
They did surgery, they removed the tumor. I underwent a course of chemo after that radiation. And they did find it early. I was diagnosed with stage 2B.
Technology in breast imaging has changed tremendously. Screening became widespread in this country in the 1980s. So since the 1980s, we've seen technology go from just film screen imaging to digital imaging, and then from digital imaging to 3D imaging. And each step of the way, these have made huge changes in our ability to detect cancers earlier.
Awareness is very, very important. We're so busy with our lives, and we seem to ignore the most important thing is taking care of ourselves. I missed my mammogram appointment by 2 months. And had I gone in October or in December, I think it was, I would have probably been at a stage 1. Too busy, I rescheduled, and I was at a stage 2.
And I think we have to make people aware of this, because so many patients say, I don't need to go for a mammogram, nobody in my family has breast cancer, or I don't have any risk factors. But the reality is, if we only screened patients with risk factors, we would miss 3/4 of the patients with breast cancer.
One of the lessons that we learned from Annette is that early diagnosis and treatment is key to survival. And this is important for not only her, but her family and her co-workers and our clients. So we decided that we're going to do whatever we can to encourage an early diagnosis.
It's been 7 years, and I am in remission, cancer-free for 7 years.
And I thought further, what else can I do? What can I do as an employer to help our initiative? Thinking in terms of the entire staff that we have. So what we decided to do is we decided to take action to encourage our staff to go for these tests, either when it's scheduled in their life cycle or if they had an issue as suggested by their physicians. So to encourage them to go for this, we decided under our initiative, Employers Think Pink, to pay for their time and to allow them to go whenever they need to go for these tests. And we've extended that throughout our entire company, and we're proud to do that.